think we're live. Hello, everyone.
Sure. Hi, take it away. You want to go?
Oh, sure. Hey, guys. Welcome to the Healthy Way Vibes. I'm Cyrene.
I am John.
Well, welcome. And we're so happy that you're joining us today. We have a great speaker on today. Her name is Dr. Theresa Peters, and you may all have heard of her. And we're so excited to get her back. We're going to talk about what is fibromyalgia and the causes and what you can do for it and the treatments. So we want to welcome Dr. Peters on.
Yeah, let me get her bio up so everybody knows a little bit about what she's all about. But yeah, we'll bring her on. But Dr. Theresa is a certified functional medicine chiropractic physician whose purpose is to help solve her patients' health issues through balancing different biochemistry and using natural compounds with herbs, vitamins, minerals, neurotransmitters, and bioidentical hormones. That's a big tongue twister. Chelators, binders, and phytonutrients, and many, many more. So she's very, very well-rounded at using different modes to help her patients. She focuses on advanced testing procedures, extensive health histories to create an effective treatment plan for her patients. She was a research scientist at a pharmaceutical company, and she's dealt with her own significant health challenges that only improved through natural means. And she's a mom of two beautiful young women, is the owner and director of Health Up Institute since 2011, and is an active lecturer, educator on many health topics, well-known international speaker on iodine therapy and its vital role in our health and healing. Besides being a chiropractic doctor with her chiropractic doctorate degree, she has a Bachelor of Science in Chemistry and Masters of Science in Environmental and Industrial Health from the University of Michigan. She's a lifelong learner with an open mind of combining science with energy medicine, and she's also been trained as a Reiki master teacher and yoga instructor. So welcome, Dr. Theresa.
Welcome.
Thank you for that long introduction.
So we're all dying to know,
yes,
what is fibromyalgia?
Okay, so fibromyalgia is something that is often overlooked and misdiagnosed. And the term fibromyalgia is kind of outdated, even though that's what we know it as, because you think fibro is like in the muscles, fibrous, and myalgia does mean muscle pain. However, with more recent research in the last 5 to 10 years, they've really defined the symptom as truly a centralized pain syndrome. So people who experience pain at a much, much higher sensitivity level. And that's going to go into great detail as we discuss today, how that affects many issues. And it seems to overlap, many different types of disorders and diseases people can have. But essentially, something triggered their body to turn the knob up on pain, that the sensation of pain, something that might not be painful for someone due to a specific event or a disease or disorder, and we'll talk a little bit more about those precipitating factors, creates a centralized pain that increases the pain levels throughout the whole body.
Mm-hmm, mm-hmm. And how early does it start? Like, I mean, I know people who have this or been diagnosed with this, but how early can someone actually kind of start getting some of these symptoms, or what triggers it, I guess, if you're
so very good. Lots of things there. When can it start? It can actually start at any age. It can start in childhood, or you can get diagnosed in your 50s, 60s, or 70s. It's because that diagnosis is based upon that sensitivity of pain. They used to go around and just check different areas if there was pain in the body and go, okay, you've got 11 or more of these areas that hurt, therefore you have fibromyalgia. But with their understanding of this centralized pain disorder, the fact that it could be young, in a child, or it could be when you're older, and you're like, well, why didn't I have it as a child? Why am I being diagnosed in my 50s or 60s? It's because of the causes of fibromyalgia. So with it being a neurological disorder, with the brain responding to some type of sensory information, that sensory information can be physical trauma, or it could be a biochemical trauma to the brain, something that is constant, something that is just relentless. And so situations that are more biochemical is situations of high stress. So high stress can come from, especially in children, trauma, traumatic experiences. They have linked children in dysfunctional homes, abusive homes, mental or emotional abuse, sexual abuse, highly associates to adulthood many problems, but significant fibromyalgia. Children, especially if they have intervened before their mid to late teenage years, they can't explain why, but that intervention actually can be healed, and the brain doesn't have this permanent change. Because part of this sensitization that happens, it's permanent. And that might sound harsh, but a lot can be done to turn that sensitization down, but anything could relight that fire very quickly. So if it wasn't diagnosed in childhood, having this chronic pain, this fatigue, I mean, the main 3 symptoms is fatigue, where nothing seems to get you out of the fatigue. You could have a long night's sleep, you wake up, you're still fatigued. You get rest, you do all these things, and the fatigue won't go away. But what goes along with it is sleep problems. So you're not getting your sleep. You usually have sleep disorder. You can't fall asleep, you can't stay asleep. Restless leg syndrome is highly associated with having an underlying centralization pain syndrome. And then the last thing is cognitive issues. So as adults, we think of more of, it's called fibro fog, having brain fog. But in children, it's going to manifest, they can't focus, they can't concentrate. They, hop to one activity to another. I mean, does that sound like something else? So that could be other things going on, and they all are related. When there's one issue going on in the brain, it's going to fire and cause dysfunction elsewhere. So of course, we want to minimize what is causing the problem and hopefully healing it. So that's more that psychological. So as an adult, stress, same thing. A woman or a man can be under long-term stress. It could be stress just from a job, it could be family, but it could be highly emotional, an abusive relationship, or other traumatic events that happen in one's life. Whether someone going off to war and coming home, or someone being physically attacked, and that's the mental side. But the other is the physical trauma that can happen at any point in time. You may have a car accident, have a bad car accident, injure yourself, and maybe you need a couple surgeries to repair the fact that you shattered your knee and your ankle. And during these months on end, your brain is receiving pain signals. It is like sensitizing something over and over and over and over. And at some point, it's almost as if it just breaks through and it's a free highway. It just keeps going and going and going. And it's very hard to turn down. But other reasons where fibromyalgia can come from, besides just that trauma, is infections. And so chronic infections, and we're well aware of things like Epstein-Barr virus, which is like mono, or Lyme's disease, chronic infections, even various of the herpes simplex viruses. They're signaling to the body at an underlying level. Maybe you don't have symptoms, but there's something going on with the immune system's always under attack. You are more likely to, one, get an autoimmune disorder, and in having an autoimmune disorder puts you at a high risk of fibromyalgia. And then, it's a cycle. It's this absolute cycle. And then the last piece of that puzzle, besides having infections, and we cannot say, COVID's going around. This is a virus. We don't know much about it. We've got these long haul COVID, symptoms people have. I really fear there's going to be a high rate of fibromyalgia diagnoses coming out. And the other aspect of a risk factor is genetics. So if you have someone in your family, a mother, a sister, a father, aunt, uncle, anybody who is diagnosed with fibromyalgia, you are much more likely to be diagnosed. But I got to mention this. They did studies on twins. So that's the same genetics. And there's actually only a 50% chance that the other one get it. So it's almost like half and half, flip a coin. One could have fibromyalgia and the other can't. So the other 50% is actually environment. So even though you are more likely to get diagnosed with fibromyalgia if your mom has it or your sister, well, guess what? You're also sharing the same environment. So the fact that there is an environmental piece really proves there's a lot of control we do have in preventing the symptoms, but also when we get the symptoms to turn the pain dial down.
So the question I have for you, I'm all about menopause, as you know. We have similar symptoms like brain fog, joint pains, muscle pains, and we also experience having problems sleeping. Now, how can we differentiate or find out if the underlying message would be from fibromyalgia? Like,
that's a great question, because definitely menopause will mimic a lot of those same symptoms, as well as many other disorders. So the way, ironically, that fibromyalgia gets diagnosed is an exclusion diagnosis. So two parts here I want to kind of address is how fibromyalgia gets diagnosed, but how having symptoms of menopause is interrelated with the potential of also having fibromyalgia or being diagnosed with it down the road. So first off, again, at any age, whether it's a child, 20s, 30s, 50s, 80s, to get diagnosed with fibromyalgia, there is no particular one test. There's no blood work, there's no urine analysis or anything to diagnose fibromyalgia. It's literally a survey questionnaire of pain. But what they also need to do, and what your doctor needs to do, is why do you have this pain? Do you have some other comorbidity, some other illness, some autoimmune, some disease, some virus, a vitamin deficiency, a nutrient deficiency, heavy metals? What else is going on? So there are certain, yes, exactly. So one, if you have fibromyalgia, if you don't address other issues that could have contributed to fibromyalgia occurring, again, it's turning that pain dial up, or diagnosing another disease that may need to be treated in a whole nother way, and that in and of itself can help the symptoms that you're having. You're going to want to look, well, nutritionally, vitamin D. Look at your vitamin D levels. You're going to want to look at your iron levels. They can be way too high or way too low. Look at B12, really affects the nervous system. Then you're going to look at inflammatory markers like a C-reactive protein or a sedimentation rate, autoimmune markers like an ANA, or there's even more, there's a whole, I would say, profile of unique autoimmune markers beyond ANA if we suspect different things. Making sure you don't have celiac disease. That gets overlooked. They don't understand how significant that is. So there's a lot of different things that should be ruled out. And then do testing for anything that is disrupting and causing those symptoms, because even menopause symptoms can overlay someone having environmental toxicities, having mold exposure. Now, granted, menopause is going to happen at a certain age and with hormone changing, but those other issues need to be addressed. Looking at iodine status, looking at the function of the thyroid, looking at the whole hypothalamic pituitary axis system. All those are very important to determine and differentiate. Are these menopausal symptoms, or do I have fibromyalgia?
Exactly.
So menopausal symptoms as well, when a woman is going through that change, you need to check the hormone levels. I mean, there is data that in different levels, it does say, okay, you're in menopause. If these are your levels, boom, this lady is in menopause. Or if she's young, there's other things going on. But someone could be 55 and actually have pretty high hormone levels. And so it's not also looking at what the levels are. It's very important to look at the ratios to each other, of estrogen to progesterone to testosterone. What is the DHA? What is the pregnenolone? But the metabolites, what types of estrogens do you have? And what are those ratios to each other? Because some estrogen metabolites are protective and some are highly indicative of DNA damage. So we don't want that. So you need to look at a breakdown of the hormonal system when a woman is of the age of perimenopause, menopause, and then work to balance and correct that. But the other symptoms of fatigue, brain fog, well, there probably are other things going on. You could be layered with fibromyalgia. You could be at the beginning stages, because to further explain the dial of pain, there's a whole range of everybody of pain. We'll take the non-fibromyalgia situation, and some people have high pain tolerance and some have almost none. They're super sensitive. And just because you're sensitive to pain doesn't mean you have fibromyalgia. If you're not walking around in pain all day long, but yet someone might go like this to you and you're like, or wouldn't bother someone, well, that doesn't necessarily mean you have fibromyalgia. You might want to look into other things. but there's a threshold actually. And there's a way to take a survey that the patient fills out that kind of can lead you into the area of what's called fibromyalgia. That is a medical term. And it's a whole range. You can be on the low end or the high end. And I think a lot of people, and especially women are 7 times more likely to have fibromyalgia over men. Not that men can't have it, but women are just more likely, that you teeter between that just super pain sensitive to the low end of fibromyalgia. And understanding that when you go into the fibromyalgia, it doesn't just mean, oh, I'm overall more sensitive to pain. No, there's actually a neurological change, and that's why it's called the centralized pain syndrome, because it's a change. And so again, now that range, the dial has the opportunity to turn up high, or maybe keep it right at that low end. If you don't address, do you have heavy metals in your body? Do you have too many molds in your body? Again, like you mentioned, what's your vitamin D levels? What's your B12? What is your hormone? You have to look at all those other underlying causes. So brain fog is highly associated with heavy metals, highly associated with hormonal imbalance. You know, it's highly associated with mold toxicity. And a lot of those, all of them, and we had a digestive health discussion, a lot of those problems of having excess mold, heavy metal absorption, you have gut issues. So you have to address the gut issues, you know, that put that up there. So that also, you know, it leads to how to diagnose this and what you need to do about it. And it is always a multi-discipline approach.
I like that you addressed it, because being the guy here, I got to represent the guys on the show. So you said that women suffer 7 times more than men. So at this point, like, you know, you can get the early screening and the early detection and so forth, and finding out what the underlying issues are if you have that. Because it sounds like everything's layering on top, layering upon layering upon layering, then something kind of ignites it. So I think you kind of addressed the beginning stuff, but what happens if someone's really deep in the suffering? Like, what is that kind of help? What kind of support can they look for?
And ironically, the people who are deep in the suffering, it's generally just anecdotally people giving their story. It's almost 20 years before they're diagnosed with fibromyalgia.
Wow.
That's why we need to make awareness. Why were they not diagnosed at year 1 or year 2? It's usually very deep-seated, and that dial is turned way up. They went through a plethora of medications and all kinds of things. And what happens is you start having these comorbidities. So even though, you know, fatigue, difficulty with sleep, you know, and cognitive issues are kind of the first things, all these other side things start happening. You start having irritable bowel syndrome. Not everybody. So you can have issues with your digestion, having the GERD or irritable bowel. You can have depression and anxiety. Depression and anxiety itself, having that doesn't necessarily put you at a higher risk for fibromyalgia. However, almost everybody with fibromyalgia gets depressed and gets anxious. And how could we not see that if for 5, 10, 15, 20 years, people think they're nuts. They think it's all in their head. They get migraine headaches, irritable bladder, like women who have to use the restroom all the time, and then they really don't urinate very much. You think, well, I'm going through perimenopause or menopause. Well, guess what? That could be that dial that's been turned up, and you may have on that range of fibromyalgia, TMJ issues, clenching at night, ringing in the ears. Those are all side issues. So finally, once you start looking at the root cause, which we talked about the different testing, because again, you're like, well, I have all this pain. What do I do about it? There's, you know, the treatment, you want to do the pain, which is the symptoms, and you need to address the biomechanical that's been going on, as well as the psychological. So psychological, biomechanical, and the actual symptoms itself. So symptoms, and I'm not a huge advocate for prescription medications, and there aren't actually any specifically for fibromyalgia, and it's usually a game that is played. Try this, try this, try this. But sometimes there are some SSRIs, kind of, which is an older way, or these SNRIs, and I'm not a pharmacist, you know, that can help mitigate the symptoms, a little bit, it's suppressing it, which we don't want that long term, but it's suppressing the symptoms so you can work on and get out of that pain. The pain, that's going to drive you crazy. You need to address psychologically and emotionally with a counselor, a therapist, working through other issues that may have occurred, and then the biomechanical. A person who's been in pain for a couple of years, 5 years, 15, 20 years, their muscles have gotten weak. They have lost muscle mass. They don't have that much lung capacity anymore. So now their fatigue is also, they're deconditioned.
Mhm.
So they need to, work with other therapists, a yoga teacher, Tai Chi, a physical therapist, people's flow, breathing, pranayama, breathing techniques, helping them get back on track physically. But it's a slow, consistent road.
Mhm.
And that's very important. So if you don't address the biomechanical and you just give them pain stuff, but their body is still super weak and deconditioned, because physically you have to address that. If you don't strengthen yourself physically, you're not going to be able to do that walk. You think it's all pain that's causing you not to walk. Well, your muscles are now weak, and you don't have the breathing capacity or the fitness to do it anymore. So the fitness part is just as important. So it's important to have a lot of compassion for yourself and empathy of what you've been through, and understand that, hey, someone might take 4 to 6 weeks to train for a 5K and they're going to run it. It might take you 12 to 18 months to walk a 5K, but that's okay, because you could walk that 5K in a year, year and a half with no pain, and you can do it. And that is turning that dial down, because now maybe you needed that medication, maybe not, because when you start addressing other issues of the nutritional deficiencies, getting toxins out of your body, the other pain signals will also start coming down.
I think it's human nature that a lot of people go, oh, they want to avoid pain.
Right.
So they don't want to, oh, I should baby it.
Yeah.
It's painful, so I can't go for a walk, or my knees hurt, or my joints hurt, and then that signal goes into the brain going, oh, well, maybe I can't walk. I can't do this. And you start using that as an excuse, right?
Or we're getting older. It's just part of life. It's just part of life is getting older. Aches and pains start to creep up, and we just
Exactly.
think it's norm, and sometimes it isn't.
And it's definitely not a no pain, no gain situation. We don't want anybody really increasing their pain. A great example of some lectures I've watched on people who have pulled themselves from the depths of fibromyalgia. This one lady's story, she said, working with her physical therapist, it was like her second week, and she walked for 2 minutes, and she felt really bad that, that was nothing. And the physical therapist is like, hey, that's 1 minute longer than last week.
Mm-hmm.
Because we don't think, and the little baby steps. Because if you do sit around all day because you're in pain, but you get up and it hurts, well, guess what? If you just getting up out of the chair and walking to the kitchen and sitting back down is all you can do, then that's what you did that day. And then the next day, maybe try to do it 2 times or 4 times. No matter what baby step you have to take, you need to, create more activity, but you don't want to create more pain. Because the other side of that coin is, it's also with fibromyalgia, there's ups and downs with anything. Like, you have good days and bad days.
Right.
And other factors that is important to mention is our diet. What comes into our body can bring the inflammation level up or bring it down. So when people have good days, sometimes they don't realize, oh, well, the day before, maybe they ate super healthy and did rest a little bit more. So what do? They go for that long walk, which might just be around the block or something. Mm-hmm. And they will take a week to recover. It's too much for someone with fibromyalgia. But then they're like not exercising. Everything seems to be normal, but all of a sudden they have this really bad day. Mm-hmm. And they don't realize the day before they had birthday cake, or they went out to a restaurant, or they ate too much sugar, and that causes inflammation. And so they got to start really linking your daily life, your lifestyle choices, from how you sleep, when you sleep, what you eat, what you do, how you think, the environment that you interact in. I mean, if you have fibromyalgia, or believe you do, you need to work with your doctor or find a compassionate, well-rounded functional medicine doctor to tease this out with you, that you create a journal, you track these things, because that multifunctional approach, a lot of it is your own self-advocacy of getting toxic people out of your life, getting rid of bad foods out of your life, learning how to eat anti-inflammatory foods. When you get good at understanding what foods decrease inflammation in your body, you might be better able to follow. There's some specific diets out there, like a paleo diet or Dr. Gundry's diet or a FODMAP diet. But many of these people, they've had no guidance, and it's been years, and all these habits are ingrained, within their whole family, and they need to make baby steps. And baby steps also mean in your diet. It's very hard to just change everything overnight. So taking and learning these different things will continue to turn that dial down so you can manage your fibromyalgia.
That's a perfect segue, because guess what we're covering tomorrow with? We have our monthly special guest, Sue Ward, nutritionist from Sana Vive. And you know what? She's going to be covering anti-inflammatory foods. So tomorrow,
Awesome.
Perfect transition to that to help address some parts that Dr. Theresa just mentioned. But also, we want to make sure that whatever all this is just for advice. We want to make sure that we're not diagnosing or we're treating or anything, that we're not telling you to not do this or do that, but work with your health practitioner and make sure that if you are starting to feel something, or you want to just kind of check things out, or if you're actually suffering from fibromyalgia for many years, hopefully something that Dr. Theresa mentioned can kind of give you an option to take a look at. So any last words from
you? If you are in chronic pain, if you've been suffering, you need help. And it doesn't mean, I need help, I'm a crazy person and it's all in my head. Well, they've proven that it's in your brain, which is in your head. It's real. And I mean, that's what I really want to stress, that chronic pain is real. And people probably are telling you you're just making it up. Mm-hmm. And if you want to, learn more or read a little bit more, kind of what I was talking about, you can go to my blog at healthupinstitute.com and read a little bit more about it. But it's important that, one, you acknowledge it, because a lot of times we don't want to acknowledge there's something wrong with us. That if you are not having energy every day and able to at least walk around and do what you need to do, and you can focus and concentrate, and where your keys are most of the time, if you can't do those kind of things, you might want to talk to someone. And if you have any co-founding issues, they're called morbidities, illnesses, digestive issues, headaches, you might want to have all underlying disorders or causes, looking at environmental toxins, looking at nutritional deficiencies, looking at, again, all the foods that you're eating. Some things might be, quote, healthy foods, but they cause inflammation because they're high lectin levels and they shouldn't be good for you, like certain, like tomatoes, potatoes, beans, or I was going to mention the nightshades a moment ago, which are highly linked to inflammation in many people, but not all. So seek help if you don't feel like you're living your most happy, healthiest life.
Yes, I want to share that it's important to ask yourself questions. Is this is the pain coming from where I think it's coming? Is it caused by something else? Am I being triggered by something? And has a past trauma has affected me? All these things that Dr. Theresa was saying, it made so much sense to me. Mm-hmm. And I'm just a curious person, and I just want you to be curious as well.
Yes, definitely. So that comes to the end of the show. Thanks for tuning in. And thank you, Dr. Theresa. Always so much stuff that we take away from it. Again, she's got a wonderful blog that people can go to find all different topics. So fibromyalgia is definitely a blog that she's covered. So we'll put the link in her in the write up for the videos afterwards when we put these up. So tomorrow, as we mentioned, we have Sue Ward, our monthly nutritionist, is going to be coming on. She's going to be talking about anti-inflammatory foods. So it's going to be perfect for those tuned in today to come back tomorrow and catch that. August, we're still planning that out to solidify a guest, because that's usually our busy month. So we are trying to book some speakers there. And then Dr. Theresa will be back on Wednesday, September 21st. And she's going to be talking about anti-aging.
Ooh.
That's a big one. That's, I think,
we all want to know.
Everybody wants to know.
How do we stay young?
That's right. We want to know the secret.
Until then, thank you so much for tuning in, and we'll see you again soon.
Thanks for tuning in. We'll
Thank
see
you.
Tomorrow.
Bye.
Bye.
Bye.